Hi, my name is Dan Gallo, and I'm a genetic counselor at the Hereditary Cancer Clinic in the Siteman Cancer Center. Frequently, people have a lot of questions about what genetic counseling is and what role it might play in their care. So today I'm going to talk through some of that information, what genetic counseling is kind of at a basic level, and then a little bit more specifically about what it is when we see someone in a hereditary cancer clinic. And I'm going to talk through a little bit about what kinds of, what reasons people might have for coming to see a genetic counselor in a hereditary cancer clinic. And then I'll go through a little bit more of the process of what exactly happens when someone comes in for a genetic counseling appointment, both before the appointment, during the appointment, and then after the appointment as well. So we're talking about genetic counseling kind of in a broad sense. Hereditary cancer isn't the only area that a genetic counselor can work. There's all sorts of different medical fields, sometimes in a prenatal setting, a pediatric setting, sometimes cardiology, that a genetic counselor can work. But one thing that all sorts of genetic counseling have in common are there's a few kind of underlying themes that all genetic counselors have, and basically they help people understand and adapt to the psychosocial, familial, and medical components of heritable health conditions or diseases. So there's a few different components that a lot of genetic counseling have in common. There's basically a step where there's an interpretation of both a person's own medical history and the medical history of their family members. There's a step that includes education, which will basically include information about a specific inheritance pattern for a given condition, the likelihood that any individual will be affected with that given health condition, some testing options that might be available from kind of a genetics perspective that might clarify whether an individual or other family members might carry that condition or be at increased risk for it, or not be at increased risk for it. And then there's other steps that can include things like managing the condition, prevention of the condition, available resources, and potentially some research options also as part of genetic counseling. And then finally, after there's the interpretation step and the education step, the key step is the counseling, where you're helping people understand this information and make informed choices based on what they've learned, and kind of help them figure out what steps might be best for them, whether it's different kind of management for their own health care, or different kinds of genetic testing, or just other steps that can help someone adapt to those to the information that they've learned. I'm going to focus now a little bit more on genetic counseling kind of in the context of a hereditary cancer clinic or an oncology setting. So a lot of the same themes that we're talking about broadly when we talk about genetic counseling are still going to apply here, but they're going to be focused obviously on people's histories of cancers and cancer in their family members. So it's going to start by gathering as much information as possible, medical information and family history information from the individual, with a focus on cancers that people have had, but also other medical conditions that might be important to know about when interpreting that history. And then the counselor is going to go ahead and interpret that information that they've gathered and discuss and kind of help to determine whether or not there's potentially an increased likelihood of developing cancer, whether it's just kind of population likelihood of developing cancer, and some other kinds of information that can go over with the person who's being seen in the clinic after they've had the chance to look over their medical information and the medical information of their family members. They're then going to discuss that information that they've been able to interpret in terms of both the likelihood that someone might develop cancer, and if there is an increased likelihood, how to manage that increased chance. So things like increased surveillance, whether it's through mammography or colonoscopy or many other ways that there can be increased surveillance to help control that situation and really empower someone to use this information to have better outcomes. And we can also have potentially sometimes genetic testing as part of that evaluation. Can talk about what this information means for other family members and available resources to people and to the family members that can help them manage these situations and this new information, and just kind of help synthesize the whole thing. And it kind of comes back to that, how to incorporate all this information for someone and help them to make informed choices based on the information they've learned, and really empower them to have this information help them in a beneficial and meaningful way. So people frequently have questions about whether or not they need to be seen by a genetic counselor, and there's a few reasons that we see people in the hereditary cancer clinic. And to simplify it, we basically see people who either have a personal history of cancer that's suggestive of a potential increased hereditary predisposition to developing that cancer, or if they have lots of other family members who, based on that kind of overall family history, it looks like something going on in that family that might have been caused by an underlying predisposition to developing cancer. And a few things that can kind of give us an idea that either a person's personal history or their family history is suggestive of a possible hereditary predisposition. There's a few things that we can really look for. So one of the big things that we look for first is just the age at which someone was diagnosed. So frequently in a lot of some of the more common cancers, there's really a specific age range that you expect to see. Sometimes people are diagnosed with cancers in their 50s, 60s, and 70s. When people are diagnosed with some of these cancers in their 40s, 30s, sometimes 20s, that can be kind of a first flag to us that maybe there's something going on there from kind of a hereditary predisposition point of view, something else going on there other than just kind of a sporadic cancer that might need to be addressed in the context of a hereditary cancer clinic setting. Another thing that we can look for a lot is if there are several family members who've been affected with cancer. So either close family members to the person that we're seeing, or family members who are all close to each other. They can all have the same kinds of cancers potentially. So if a sister, a mother, and an aunt all have breast cancer, or they could be a few different kinds of cancers that sometimes strike us as being associated potentially with an underlying genetic predisposition. So certain kinds of cancers, for example, if you saw colon cancer and uterine cancer together, would suggest that maybe there's an increased hereditary predisposition based on kind of a familial clustering of those kinds of cancers as well. A few of the other kinds of things that can let us, or at least make us consider that there might be an increased hereditary predisposition, or at least somebody that we should be seeing in clinic and having some of these conversations with, are if someone's had multiple primary cancers. And a lot of times people are a little confused by the difference there between multiple primary cancers and a cancer recurrence. So frequently, first cancer can kind of occur somewhere in the body, and then that cancer can spread somewhere else. And that's not really what we're talking about when we talk about multiple primary cancers. When we talk about multiple primary cancers, we're talking about something where maybe someone has a cancer diagnosed in one part of their body, and then they have a completely separate cancer occur in a different part of their body. And when someone has two entirely separate cancers like that, it's another thing that we can say, okay, maybe there's an increased hereditary predisposition for this cancer. And another situation that kind of occurs that we think maybe someone needs to be seen in a hereditary cancer clinic. Some specific kinds of rare cancers just occur. When they do occur, frequently are associated with potentially an underlying genetic change. So sometimes, if it's a very specific type of cancer, just that diagnosis alone is a justification to be seen in the hereditary cancer clinic by a genetic counselor. And finally, if someone has already established in their family that there is a known genetic change associated with a hereditary predisposition, then we'll go ahead and we can talk people through that and what that means for both themselves and other family members. So I'm going to go ahead now and talk basically through the process of genetic counseling, and I'm going to focus on kind of the hereditary cancer clinic and how we do things. There's a lot of different ways to do cancer genetic counseling. I'm going to kind of focus on what our process looks like, but really one of the big takeaways is that it is indeed a process. There's a lot of kind of different ways that this step can happen based on where you're seen, but most of them it is very much an ongoing process and not just kind of a stagnant one-time thing at your appointment. And this definitely, it begins well before the time that you're seen in the clinic, and also continues well after that time. So prior to the time that we actually see someone for genetic counseling in our clinic, we start by asking them to collect a little bit of information about their family history. So they can go ahead and have some time to ask other family members questions, to clarify everyone's medical history, figure out who was diagnosed with what and when, and try to get a little bit more of the specifics, whether they need to contact other family members. Sometimes they're not as in good touch, but trying to gather as much information about that as possible before their appointment can really help us in terms of providing them with the best information that we can give them based on as complete a picture as possible. We can also ask people before we see them in the clinic to gather as much medical information as well. So in addition to talking with their family members and trying to gather that information, sometimes there's very specific parts of their medical history that can be helpful. So they might be things like cancer treatment notes, doctor's notes, pathology reports from their cancer. Sometimes if someone's already had genetic testing, some of the genetic test results can also be very helpful to see that before we see someone kind of in the face-to-face setting. And that, again, it can provide us with as much information as possible to have going into the appointment, so we can provide the person with most accurate and kind of focused information at the time of the appointment. Now, one of the ways that we use to kind of, I alluded to people collecting their family history and asking family members about these different things that have potentially happened with family members and being diagnosed. One of the ways we record this information is through a family history or a pedigree information. And as you can see here on this form here, this is kind of a pictographical, just a picture of someone's family history kind of drawn out through squares and circles. So in this picture, all of the circles indicate women and all of the squares indicate men. The arrow is pointing to the person that we're hypothetically seeing here in clinic for kind of the face-to-face consultation. And you can see down here on the bottom row, these are two sisters and a brother who are all kind of connected by a common line there. And then if you go up, the two individuals kind of closer to the center are the mother and the father, those three individuals below them. And then off to either side of this mother and father, to the left there is the sister of the mother, and then off to the right is the sister and the brother of the father. And it also is kind of highlighted by different family members who have had cancers at different ages. So in the middle there, the sister of the person who's being seen in clinic has been diagnosed with breast cancer at age 39. Her father was diagnosed with colon cancer at age 65, and her mother's sister, so her aunt, was diagnosed with ovarian cancer at 48. And this is kind of the information that we'd be interested in someone gathering prior to their appointment that we could go out and discuss with the person at the time of their appointment. So at the time of the appointment itself, a lot of the times it's going to start with a step that we basically just call contracting, and that's something where we touch base with the person before we even get into all the details of their medical history and family history, and just try other providers. So if we say, okay, now that we know that there might be an increased likelihood based on your family history, maybe we're going to tell you to go ahead and get earlier mammograms or earlier breast MRIs, and we can help coordinate that screening through other providers shortly after our appointment, and then also potentially getting the genetic test results if genetic testing was something that was done at the time of their appointment, and talking through some of the possible results and kind of the outcomes there based on if the testing was positive or negative or potentially provided kind of ambiguous information. We can talk through those results after the appointment as well. There's some other steps that can occur kind of in the long-term follow-up after an appointment. So not necessarily something that's going to happen immediately in the first few days or weeks, but things that can happen just kind of in just the long-term follow-up after an appointment. And those can include talking with other family members about the information that was shared with them and discussed with them at their appointment. So a lot of the things that we discuss in a genetic counseling setting are going to be relevant not just to the person being seen, but also to other family members. And when that occurs, it's something that we can say, okay, share this information with your brothers and sisters because they might have a very similar medical management strategy as yourself. It really kind of depends on an individual case-by-case basis how that conversation goes and what needs to be shared with other relatives. But that's certainly something that happens frequently. And frequently, kind of in the long-term follow-up, we also ask that people touch base with us sometimes on an annual basis just to see if there's any new updates in the field of genetics or cancer genetics that might be relevant to their care, because it's a moving field, and sometimes things that are available now aren't really what will be something that we'll be practicing in the future, and things that if someone was seen several years ago, there are things that we have now that we might be doing differently. So just something that we ask people to stay in touch with and can potentially provide them more information kind of as the field progresses. And finally, there's a few additional considerations that I thought were important to highlight, just for the completeness of this video's sake. One is just that a lot of people may have had genetic testing, but not through a genetics provider, and sometimes when this happens, there's just a question of whether or not the total kind of genetics evaluation for both the person and themselves has been kind of done completely. So sometimes someone might just have a negative test result, but there can still be other medical management issues. There can be other family members who might benefit from a little bit more information about the hereditary nature of some of these conditions. And finally, if someone has had genetic testing through another provider, there's just a question of whether or not that testing is still up to date. So as I was alluding to before, it really is a moving field, and sometimes the testing that was being done 5 years ago is different than what we're doing today and what we might be making recommendations on, and that's continually evolving. So it's something that can really help to meet with a genetics provider to see if there's anything that might be new and relevant for you or your care.